there will be one session that will be in Spanish. So if you need translation, there is the translation devices outside of the auditorium. Most of the sessions will be in English, but welcome. Good morning. I think it's the right time to start. So my name is David Rojas. I'm a professor at Colorado State University, and I have the pleasure to be the moderator of this session. I will give a quick introduction about the topic. This is the session transportation. And we have a fabulous panelist here that also will present some of the perspectives related to transportation, air pollution, and human health. So after the presentations, we'll have time for questions and answers. And we hope this session is more interactive. So please don't be shy, ask questions, take advantage of this expertise. And we want to here to have a dialogue and learn about what your needs, opportunity, experiences, and share with us in this room. So I will be starting with some quick introductions about the topic. You will see the panelists' names here. So at that time, I will be presenting, allow them to present themselves. So just want to put the topic of transportation on the table and make the case so you can see how this is connected more clearly to air pollution. And transportation and air pollution are connected in many pathways and many ways. One of those is the urban planning and the context of the local areas. We have many opportunities and many interventions that decide how our cities are shaped. And one of those is land use density, but transportation is part of that. Connectivity, how we live in proximity or how far we live from other locations. Those factors in urban planning actually decide how we move. If we are allowed to access those destinations walking and cycling, or if we need to travel far and then take a motorized vehicle. So it's here that you start seeing those connections. And that mobility behavior will impact many other factors, including air pollution. So there is great opportunities here that influence urban planning, transportation, and then the pathways that connect with human health. And we are talking about diseases, multiple diagnoses, multiple organs and systems, and of course, mortality. So all this chain is connected. And you see here, we have this fabulous conference on air pollution that is a very important topic and how this is connected with transportation. So there's many other pathways and risk factors that are also highlighted here, but we have the opportunity to have interventions in one of those in transportation and benefit not only air quality, but also livability, better cities, better places where we live. And just put in the context, there are many potential interventions in transportation. One of those, bicycles. And this is something that you see more often. And there are many co-benefits related to bicycles. So this is an example of the public systems in the US and how we can use many epidemiological approaches to quantify the benefits in terms of morbidity and mortality and health economic impacts. And this is just to give you a context as what is the actual impact in public health in terms of mortality and morbidity of public bicycle systems in the US. what you see here is a quantification process. And what we identify is that around 5 premature deaths can be avoided, postponed, or prevent each year just for the amount of bicycles and trips that are happening in public bicycle systems in the US. This is roughly 36 million US dollars of economic impacts per year. So if those bicycle or cycling levels are maintained, that will be the benefit across the US. There are many new technologies. I just give you a context of what is happening, and you have seen those e-scooters in many of the cities. So we are also learning about what are the impacts of those. They're deployed everywhere. So there is no continent they're just missing. They have an incredible expansion globally. This is an example of analysis between two cities in the US of what is the impacts of these scooters. And we compare benefits and risks. Benefits, physical activity. When we are talking about transportation, we are promoting physical activity. There are risks of suffering a traffic injury, fatality, or inhaling air pollution. So just give you the context that Atlanta in the US, there's a lot of trips in e-scooters. And what we found is that comparing risk and benefits, actually shifting to e-scooters is not a good idea. You have more risks of suffer an injury if you jump for any other mode of transport. So probably if you're in Atlanta, you don't want to shift to e-scooters. You want to stay walking, using a bicycle, or using motorized transport. We compare with Portland in the north part of the US. And what we find is that it's not a bad idea there. So this is important messaging because what we are learning and what we learn from these panelists is that probably the context matters a lot. So we cannot generalize all the interventions will be equal in each city. So this is an important point that I want to raise here. In this case, Portland is different because they have a lot of infrastructure for active transportation. There are a lot of awareness between drivers about cyclists already. So the perception and the management and the behavior is different. And just to give you a sense in the future, what is happening about the future, and we want to talk about potential benefits and what we can do today in terms of policies and what will reflect in the future. This is analysis for 2050. What if now we implement policies that are very ambitious in terms of active transportation, especially to promote urban cycling? This is an analysis in 17 different countries. If we implement very ambitious policies now for cyclists and promote urban cyclists, we can gain a lot of benefits. And the trend in the future is not very good. What you see in the red line is that the more developing countries are actually increasing or expecting to increase a lot of car trips in the future. The developed countries will stay the same or diminish a little bit of that use of cars. But in terms of bikes, actually, we are expecting that the levels of urban cyclists in many countries in the developed world will decrease. So we are pushing people outside of bicycles, and we are doing that in those areas that they need it the most. So if we implement policies now, we can gain a lot of benefits in the future. So we quantify what will be the benefits in the future if we invest in those policies today. And what I wanted you to look here is the amount of premature deaths that we can gain in 2050 if we implement policies today. More than 200,000 premature deaths could be avoided, postponed, or prevented in 2050 if we have better policies implemented today. So this is a great opportunity. This is a lot of people we can save. And transportation is also about public transportation, transit. This is Barcelona in Spain. They want to connect tram to different routes, and that will remove many of the car trips. And this is the evaluation of that new line of tram that they wanted to implement. Around six premature deaths will be impacted or prevent, postpone, or reduce if they implement that tram. Very important, and the economic evaluation of that is $21 million euros will be the economic benefit of that, just related to mortality. The implementation of the new line is 51 million euros. And the maintenance of the line is 6 million euros. So there's great opportunities here, and it's just one of the aspects to take into the pool of decisions. Finally, bus rapid transit. This is something that coming more and more common in many cities. And we did an analysis in multiple cities, in 8 cities in the planet, and we see that all the BRTs are providing more benefits and risks. So there is certainly, from the health perspective, an opportunity there. More than 600 million US dollars of benefits. So again, I want to put this in the context. This is the pathway that the connections between urban planning, transportation, and in this case, air pollution, and the great gains that we can see in terms of morbidity and mortality. So I will stop here and allow then the panelists to start talking and presenting their cases. So I will start with Julian, that give us the perspective from Bogota. So, and I will allow Julian to introduce himself.
Thank you so much. I'm Julian Fernandez. I'm the Deputy Secretary of Public Health in Bogota, the capital city of Colombia, as probably you know. And I am in charge of a lot of collective actions that we are promoting in our city. However, today I'm not going to speak on behalf of the Secretary of Health, but on behalf of the mayor. So I'm going to try to explain the efforts that we have done in the last decades in Bogota. And when I say we, I refer to the effort of different administrations. ¿Puedo tener la presentación? Sí. ¿Qué pasó?
Oh, sorry. We have the slides of Hanin first. Okay. Bueno, comenzamos con Hanin. Sorry. So.
Yeah, sorry, I was asked to open the session, so I was like, my presentation is an open presentation. Well, welcome everyone. Hi, my name's Hanin Kreis. I'm a senior research scientist at Texas A&M University and the University of Cambridge. And I'm going to be giving you a bird's eye view on the issue of transportation, air pollution, and health. So, and it's going to be, again, just a higher level opening into the more specifics that my fellow panelists will talk about. So the way we move around between cities, within cities, is very important for our public health, for the environment. Transportation is a challenging sector. It's a sector it's been hard to decarbonize. It's a sector that's responsible for a large proportion of air pollution. I'll be showing you some statistics. But it's also the single largest component of the global consumption of oil. And in many regions around the world, although we see some reductions in places like the European Union, in the US, although that's likely to change because it was based on very recent bills and acts. In many other regions, the demand for oil in transportation is rising. And as you can see here, I'm showing just some examples of Southeast Asia under different scenarios, Latin America and the Caribbean, the Middle East and India. So it is a problem, and it's a problem that is expected to last. Now, when we look at global emissions of transportation, it is also a major contributor to a wide range of emissions that have adverse health impact. And transportation across the world currently, and in terms of projections in the future, is the largest share of nitrogen oxide emissions, as you can see here. Globally, is estimated to be responsible for 54% of global NOx emissions. It's also responsible for other pollutants. So PM 2.5 has been a central focus of this conference. These are the results of a systematic review that many of you are probably aware of by the WHO that looks at the contribution of transport to PM 2.5 within urban areas. There is large variability and heterogeneity, but it is responsible for quite an important proportion. So if we look at North America, for example, 24% of PM2.5 in urban areas and cities is estimated to be from traffic. South America, Latin America, 34 and 30%. If you look at other areas like the Middle East and Africa, there are other sources that start dominating, which are mainly natural sources, including dust and domestic fuel burning. Overall, at the global level, we're estimating that about 25% of global PM2.5 in urban areas is a result of traffic. So in terms of health effects, I thought this is maybe the most seminal report on the health effects specifically of traffic-related air pollution. This is coming out of the Health Effects Institute in Boston. And they've recently concluded that there is strong evidence that links traffic air pollution with the risk of death, including cause-specific deaths, but also a global burden of disease like childhood asthma and respiratory infections in children. And you can look at this report. I highly recommend it. And there are also emerging outcomes, which I'm going to talk about in a second. So I'm glad George is in this crowd because I'm going to point to him if we have any questions on this. But these are results from the Global Burden of Disease study looking at the burden of death, premature mortality from specifically transportation-related PM2.5. And what I want to highlight on this slide is the number, 300,000 deaths per year specifically related to transport. This number is underestimated. It is likely to be much higher. And actually, when we look at different pollutants that are better markers of traffic, we do see a much larger burden as well. And as you can see also, there is large heterogeneity and inequalities in the burden of death from transport PM2.5. The burden extends well beyond mortality. We talk about death very often. We use it in regulatory processes like cost-benefit analysis and regulations. But there's also a very significant burden of morbidity. I am interested in childhood asthma, and we've done those quantifications around the world. And in certain cities, the burden of new cases of childhood asthma that are preventable, as far as I'm concerned, can be around 12% of new cases a year related to traffic-related air pollution specifically. We've also been looking at emerging health effects, and there's been some really interesting talks and during the conference looking at brain health, for example. And I did want to highlight that we've recently finished a meta-analysis of about 30,000 people from across the world and found that there's really strong and robust evidence linking air pollution from traffic and dementia, the onset of dementia, and some suggestive evidence with black carbon, which has been, it's been referred to many times at the conference as a super pollutant, and it's also related very closely with traffic. So what can we do? I think people will talk more about solutions, but I just wanted to kind of take a step back and share with you some perspectives. I think the main thing that we can't do is, think in a reductionist way of like one exposure, one outcome, one intervention. And this approach has failed us many times. I would make an example of the diesel car boom, where there was a shift based on reductions, the need for reductions in carbon dioxide emissions in the European Union. That wasn't the best move at the time. And what we need to think about is not just air pollution, and this David already talked about this very well, but we need to think about all the other pathways and all the other exposures that link transportation decisions to health. We have counted 14 of those pathways. Air pollution is important, but some other ones that come with a burden of disease that is comparable and sometimes even higher than air pollution, depending on where you are. What's the baseline health of your population? What is the baseline exposure? Physical activity comes out as super important as well, traffic noise and vehicle crashes. And there are other ones which we might get to in the panel, which we've only recently started to quantify, like heat, contamination, greenhouse gases. And there's one that we haven't quantified in burden of disease assessments, and they remain not quantified. So in general, the burden, the idea of the burden that we have is rather limited. So to do these quantifications.
Bueno, aquí tenemos cuantificaciones y los demás conferencistas van a hablar un poco más. Querían
Developing over years at the University of Cambridge. It's called ITHM, the Integrated Transport and Health Impact Modeling Tool. And we recently applied this to 20 cities in Central and Latin America and some cities in Africa and India as well. And the tool looks at the impact of modal shifts on death and years of life lost. And it includes collisions, air pollution, and physical activity. So it is slightly more holistic than just, or it is more holistic than just looking at air pollution. So this paper is under review. It's online. These are results from Bogota I thought are relevant for maybe this audience. And what I'm showing here is a scenario where we look at travel survey data. So we look at the baseline travel patterns in Bogota. And we say, well, what if we shift 5% of the trips to buses, depending on their distances? So we account that bus trips are like a certain length on average and certain duration. What if we shift 5% to buses, to cars, and to cycling? And then we look at the health impacts, and we look at them in total, and we look at them disaggregated by pathway. So fatalities, physical activity, and air pollution. And you can see the results here, and the take-home message generally, which is in line with a lot of other health impact assessments from around the world, that cycling, which is very intense or high intensity physical activity, and taking the buses, which includes a walking component to and from bus stops, and that walking component is super important in this analysis, are beneficial to health on the whole. When you look at specifics, you see most of these benefits stem from increases in physical activity, including from that component where you walk and come back from the bus stop. And lesser kind of benefits stem from reductions in air pollution. There are lots of methodological challenges here. We're using PM2.5, and I don't want to get into it, but this also might look different if you look at different pollutants like black carbon. But physical activity emerges as the thing driving or the pathway driving those benefits. And of course, the car scenario is adverse on the whole, with some small reductions in fatalities from traffic incidents. So my take-home message, and we've looked at policies in general. I'm going to show you an example of where we assessed multiple policies. But when we do this analysis, I kind of go back home thinking that we shouldn't be looking at one policy. We shouldn't just be looking at switching to cycling, because if you switch to cycling, your risk of injury might increase. It probably will increase. So we need to look at packages that work synergistically to reduce, to be more effective, to be more easier to implement, to reduce barriers, and to also deal with unintended consequences. And this is just underlined by the idea that multiple policies will improve multiple pathways. And again, there are unintended consequences. And when you look at the evidence, there are certain policies that seem to address multiple pathways, but they're also long-term and sustainable, like land use and behavioral policies. I'm particularly interested in the Barcelona super blocks, which we studied, the London low traffic neighborhoods, which we're studying now. I'm going to show just very briefly what the initial results of the London low traffic neighborhoods. So I don't think you can see them very well, but they statistically reduce the injuries and the fatalities from traffic crashes. They reduce air pollution also significantly and increase physical activity by about 2 hours a week after 2 years of residence. And we can talk more about this, and there's still a lot of ongoing work with those areas. But the last couple of slides I have is, okay, well, what can cities do, and where can they find some of these policy measures and these packages specifically? And a few years ago, funded by the US Department for Transportation at the time, we wanted to synthesize and index all these options for cities and practitioners and policymakers. And we created this database, this open access database, that includes over 1,000 unique policy interventions from 376 peer-reviewed papers. And this is the geographical coverage in the world. As you can see, there are large swaths of the world that are still unrepresented in the academic literature. And we are working with WHO, thinking about expanding this and updating it and including things like cost effectiveness and health outcomes as well. But you can find this database. I've put a QR code here for people who are interested. Again, this is open access. I'm also happy to talk people through how to use it. You can find the QR code here, and these are some examples of the policies that we have indexed. And I should have said, these are transportation policies specifically that we're looking at. These are transportation policies. And these are some examples of the ones that we have in the database. So that's my general introduction into the topic. I think people will have more specific case studies and examples, and I just wanted to acknowledge all my colleagues and friends who I have worked with on these different papers and projects. Thank you so much.
Thank you so much, Hanin. We'll be jumping to the next presentation. The next presentation is Joe. Yeah.
Well, good morning, everyone. The slide? No, that's not it. Oh. Thank you very much for your attention. Okay, that was a nice icebreaker. So my name is Joseph Spadaro. I'm an environmental research scientist. Currently, I'm based in Paris, where I do some teaching at the École des Mines. When I'm not in the classroom, I work with WHO, the European Environment Agency, the European Commission, and others to further the science of health impact assessment and economic analysis. I'm happy to be here today. Thank you very much for the organizers for inviting me. And I'll be talking about sustainable urban mobility, health impact, and economic assessment and tools. I will add a few extra statistics to what Anina's already introduced, and perhaps others will have additional statistics to add. So let us look at the benefits and the challenges of transportation. The benefit, well, a reliable, efficient, and cheap transport system is essential for socioeconomic development, but this comes at a price. There are pressures. The rapid development of the transport sector has led to an overburden. The infrastructure can't keep up, and this is particularly evident in fast developing economies, particularly, let's say, those in Asia. Over the decade 2000 to 2010, the transport demand in Asia doubled in just one single decade. If we look forward into time, we know that the travel demand will increase. It will be multiple times what we have currently if we look as far out as 2050. And this will happen because as people become richer, they can afford and want to have a car and want to have the independence of driving a car to move around, to do their daily chores and also recreational activities. The demand for travel has led to an erosion of the quality of services. It has increased urban congestion. There was one European study where we calculated an increase of burden of congestion equivalent to 270 billion, that's with a B, billion euros, which represents roughly 1.8%, just under 2% of the GDP of the European Union, which is on the order of $15 trillion a year. Obviously, transportation leads to degradation of air quality. It leads to traffic accidents. And it turns out that roughly 1 out of 3 fatal accidents around the globe can be linked to road transport. In Europe in 2023, There were approximately 20,000 deaths due to traffic accidents, and most of these, the main culprit was a collision between a car with another car, a car with a pedestrian, car with other vehicles, light-duty vehicles. Now, on the right-hand side of the slide, I try to, for myself, to do a Q&A session where I pose different questions and try to provide answers to those questions. So the first question is, well, how many vehicles are circulating on the road around the globe? And the answer is about 1.4 billion vehicles. 3/4 of those are passenger vehicles and taxis. Battery electric vehicles represent about 20 million units, but they are growing very, very rapidly over the past few years. The vehicles are distributed primarily in Asia and the Pacific region, obviously high population densities, therefore there's more cars there, about 50%, an equal share in Europe and North America, and about 10% outside of these three areas. In terms of fuel and powertrain, the typical cars on the road are still gasoline and diesel. Gasoline outweigh diesel cars by a factor of 2 to 1. Hybrids, both the independent and plug-in type, represent between 6 and 9% of the total vehicles on the roads, and electric vehicles and fuel cells make up an additional 3 to 5%. Being here in Colombia and having to go through Bogota to reach Cartagena, I was curious to look at the trips, the number of trips that are carried out in Bogota. And you can see that I split it between public transit, active travel, and cars. And the values are 38% are for public transit, another 35% using active travel, and 27% car. These numbers are quite different than the average values that you see at the global level, which are shown in the parentheses. So let's look at the carbon footprint and other major air pollutants from transportation. So on the bottom, you see that about 19% of emissions of greenhouse gases can be linked to transport activities. You can see how the trend has changed over time over the last 3 decades, from 1990 to 2019. Over that time period, there was an 80% increase in greenhouse gases. And the major contributor is the yellow part, which is road surface transport. Again, a Q&A section on the side. I asked myself the question, how much does transportation contribute to emissions? Well, the answer is about 15% of all PM2.5 emissions. Another 20 to 25% are for black carbon, which is a component of PM2.5. You have nitrogen oxides, 40 to 50%. 5 to 10% for SO2, and carbon monoxide, 20 to 30%. The next question I asked myself is, well, can I say how much transportation is contributing to the observed PM2.5 concentrations in the air? And the answer is yes. It contributes between 14 and 45% of the concentration of PM2.5. On average, globally, that's about a quarter, which is the figure that Anine had mentioned a short while ago. And the value of 45% is in areas like low and middle income countries, the places where they can't afford to have such a high level. And then finally, what are the health effects of these emissions? And over the past 2 days, we've been talking about all the different connections between exposure to PM and other pollutants and adverse health effects. And so these are respiratory and circulatory diseases, metabolic effects, lung cancer, and neurological diseases, just to name a few, including autism and dementia. So the next 2 slides, I just wanted to give you sort of like what kind of costs are we talking about. So I looked at a global analysis of the situation in 2015. This was a study published by Susan Annenberg and colleagues in 2019. I prepared my own graphic on the right of the slide, and on the left of the slide, I just copied a slide from their paper, but I highlighted a few extra things in it. So each circle corresponds to a city. The size of the circle corresponds to how much of a damage occurs in that city as a fraction of the total damage of air pollution in that city. That's what we call the transport attributable fraction, or TAF. And you'll notice that in the graph that you have the number of deaths due to PM and ozone exposure along the y-axis, and along the x-axis you have the size of the population of the urban center. It's no surprise there's a linear relationship. The larger the city, of course, you're going to have more health effects. But what's more important is to look at the upper part of the range and the lower part of the range. On the upper part of the range, those are cities that are located in high-income areas, whereas in the bottom part of the range, it's the low-income areas. On the global level, there were about 385,000 deaths. Haneen had mentioned about 300,000, so we're pretty much saying the same thing, 300 to 400,000. Yes, the estimate is an underestimation because these only include the effects of PM and include the effects of ozone and use the exposure response functions of GDP, which are curving as you go to higher and higher exposures. So if you had used different exposures, such as the global exposure mortality model, the GEM function, the number might be at least twice as large. The 385,000 deaths corresponds to roughly 1 death out of 9 that have been estimated. So during the past 2 days, we've been talking about this figure of 7 million. About 4 million or so are just due to outdoor air pollution. And so out of that 4 million, 1 out of 9 is due to transport sector itself. And then on the bottom, you see the cost of this. The cost is $672 with a B billion dollars, which represents roughly 0.6% of the GDP of the world. And the main culprit, diesel, which accounts for half of the mortality. In this study here was a study that we did in the European Union in 2016, and we calculated the burden of transportation. But apart from looking at tailpipe, we also considered the full life cycle. So what I tried to do is to represent for you the stratification of the cost by cost category and by transport mode. Those are the 2 pie charts that you see on the right side of the slide. And you can see that accidents and congestion account for the 2 biggest portions. If you look at the transport mode, it's passenger vehicles that contribute the largest part of the cost. If you look on the left-hand side of the slide, you see the same data, but aggregated according to mode of travel. So whether you have cars, whether you have commercial vehicles, buses, motorcycles, rail, shipping, and aviation. The total cost in Europe in 2016 was 1 trillion euros, which is equivalent to 6.6% of the GDP of the European Union. And about 14% of that is just tailpipe emissions. So I'd like to bring my presentation to an end by just introducing you to 2 tools. Yesterday, Heather, in her presentation, had mentioned, what is WHO doing? Okay, so I am helping them to achieve their targets of things that they would like to do together with Pier Paolo and other members of WHO. So I highlighted 2 particular tools that have been developed for WHO. One tool is the ISTAT software, which stands for Integrated Sustainable Transportation Health Assessment Tool. And this software is currently being updated. It's being expanded, and further modes of travel are being added. Methodology is being improved. And when it will be released, it will be released as SUSTRAC H. And you saw SUSTRAC on the slide that Heather had showed us yesterday. So what is ISTAT? Well, ISTAT currently is an Excel-based tool that aims to calculate the health, environmental, and economic benefits of sustainable urban mobility plans. It allows the user to compare a baseline as usual and several alternatives and compare 1 to 1. You can compare from present out to 2050. And in addition to forecasting the energy demand, forecasting the activity, forecasting the emissions over this time period, the tool will try to calculate what are the preventable health burdens, the averted carbon emissions, as well as the benefits of physical activity. And these benefits will be displayed to you not only in terms of physical units, number of preventable cases of asthma is an example, but also the economic cost of those preventable cases of morbidity. On the right-hand side of the slide, an application of ISTAT. This was a case study that we did in Accra, Ghana, and Alex, I guess, I'm not sure if he's here today. Okay, so he was one of our partners that we were working with him. It was part of the WHO Urban Health Initiative. And the graph that you see here shows how the baseline is usually in alternative scenarios that we devised, how they varied in terms of emissions of PM and NOx, the top two graphs, and on the bottom, the benefits to health in terms of mortality on the left and in terms of the economic benefits. We also value the economic benefits of morbidity and other health endpoints. And my last slide is another model that has been developed for WHO, the HEAT model, which stands for Health Economic Assessment Tool. And the goal, the aim of HEAT is to answer the question, if you have so many people engaging in cycling and walking over a prolonged period of time, what would be the health benefits to that population, as well as what is the economic cost to society, or benefit in this case. It is designed for both experts and non-experts. It can be accessed online at the website that I indicate on my slide. And just to show you an application of the HEAT methodology, I show here two cases. On the right-hand side, I consider the case if I'm in Paris and I decide that I leave my car at home, but I decide to cycle. I do this for 1 year. What is the economic benefit of that transition, of that shifting? And the benefits are indicated in green. The negative consequences are indicated here in red, so I call that the impact. But you can see that if you do a benefit cost analysis, that there's a lot of green compared to the red, which means there is a net positive benefit in engaging in such activity. The two big categories are the benefit to the person who is cycling, as well as the reduction of congestion across the city. On the right-hand side bottom, the HEAT methodology has been applied or integrated into the ISTAT tool. And so the question was, what if I convinced enough people in Kaunas, the second largest city in Lithuania, to leave their car at home and use public transit or use cycling and walking to work? And here I represent what is the benefit from over the period 2016 to 2050 in terms of the number of preventable deaths, what is the economic value of that. But in addition to these benefits, you have lower levels of pollution. So there is approximately a 20% reduction in the benefits of preventable premature deaths. Everybody has to die, so you can postpone or delay them. And what is the reduction in the greenhouse gases, which is roughly a third of the greenhouse gas budget for the city. So I thank you very much for your kind attention. I'm at your disposal for any further questions or clarifications that you might have. Gracias.
Thank you, Joe. And now we'll be jumping to the more other perspective, Soraya.
Sure. Thank you so much. Oh, it was Sergio, actually. Okay. Do you want me to go first, or? We can do a joint presentation. No, no.
You want to?
Oh.
You want to? Sorry. Yeah.
No problem.
So we have Sergio here from EDF that will be presenting before Soraya. Sorry about
that. My name is Sergio Sanchez. I work with EDF as Senior Policy Director for Global Clean Air. And I would like to start my presentation by reminding the story of Ella. Yesterday we were told by Rosemont Kissy Debra, her mother, that Ella died in 2013, being 9 years old, because an asthma attack after a number of years of being sick. And so can you imagine this mother wondering why her daughter died? And then he got some support and he started a legal fight in order to get a clarification and then to request the legal recognition about the relationship between the death of her daughter to air pollution. That's precisely what we are going to speak about today. And my key messages is that heavy-duty vehicles, and that's a different dimension to what we have been speaking so far, is a major source of pollutants, including black carbon. Black carbon is a particle, but also other pollutants. And black carbon is a short-lived term climate pollutant, meaning that it warms the planet, but also is a pollutant that harms our health. And why it warms the planet? Because as a particle, the black carbon particle represented here schematically is comprised by a core of carbon that is black. When it is in the atmosphere, it absorbs heat, but also when it is transported to long distances, it is also warming the glacial surface, and then it melts the ice. But beyond its climate impacts, also the composition of this particle includes a number of nasty materials, including organic volatile, organic compounds, also secondary particles, heavy metals, and a number of toxic substances. And that's one of the reasons why the California Air Resources Board has considered, for example, the diesel particles are a carcinogenic compound. So vulnerable communities bear a disproportionate burden from these emissions, and the solutions exist, including electrification, emission standards, logistics optimization, and urban planning, including some interventions that my colleagues have mentioned. And stronger regulations are needed to stop the transfer of pollution from the global north to global south. We have been discussing in this conference about the progress some countries are achieving in terms of the electrification of the fleets, but the old diesel vehicles many times end up in the global south, increasing levels of air pollution and representing a major source of emission transfer. So what are the sources? High emitting vehicle types. We tend to talk about the vehicles, long-haul and short-term diesel trucks, transit and intercity buses, construction and industrial machinery. But also, we should focus at high emission locations, the increasing number of warehouses and distribution centers, ports and freight terminals, major highways and congested corridors that represent a major origin and destination of a significant number of these vehicles. How to remove black carbon from heavy-duty vehicles? The answer is, of course, transitioning to zero-emission vehicles and zero alternative fuels, electrifying fleets, phasing out diesel, and accelerating the shift to zero-emission alternatives, reducing pollution from existing fleets with diesel particulate filters, while transitioning to fleet electrification. And we need to strengthen regulations and trade policies, including the implementation of emission regulations, more and more stringent, establish low emission zones as one of the major strategies that are multi-solution, multi-pollutant, and multi-benefit approaches, and prevent the export of polluting heavy-duty vehicles to the global south, which is an issue that I insist has not sufficiently been addressed. Let me tell you briefly about, in a nutshell, some of the work that EDF has been doing in the United States for unlocking the understanding of cleaner benefits. And this is part of our research specifically on black carbon and PM 2.5. Freight hubs generate high related pollution to these vehicles, disproportionately affecting low-income and minority communities. Why? Because 15 million people just in the United States live nearby warehouses with high diesel truck traffic, meaning the areas in which these facilities are located, but also the highways and roads in which these vehicles circulate. Traffic-related air pollution imposes a significant but uneven burden because the Black and minority communities are the ones that tend to live in these areas, and poor communities extending to other parts of the world. Elevated exposure to black carbon and co-pollutants is linked to serious health diseases that have been mentioned, and just emphasizing increased rates of heart and lung disease, asthma, birth complications, and it was mentioned also mental disease complications. Strategies to reduce exposure include, among others, the expansion of air quality and emissions monitoring. That's crucial because the typical air quality monitoring networks are focused on the average levels of pollution, but lack the understanding of local exposures. Expanding hyperlocal monitoring in highly densely populated areas, but also along corridors, is crucial to understand this issue. Accelerate fleet electrification. I have mentioned about this. Create buffer zones and tree barriers. It's another strategy. And strengthen urban planning and community engagement. What are the health and equity benefits of reducing black carbon, which leads also to the reduction of these pollutants? Air quality and public health benefits. We have seen that these strategies result in reduced air pollution, particulate matter, ground level ozone, hazardous air pollutants, and nitrogen dioxide, improving health outcomes in the different indicators that I already mentioned. But it also leads to equity and economic benefits because it goes directly to protect the health of these populations that live in disadvantageous conditions, protecting them, lowering healthcare costs, but also advancing towards climate and urban resilience goals. And it has also far-reaching benefits beyond air quality improvement. Safety has been mentioned several times in this panel, but I will also add noise levels that can be reduced with these interventions, as increased, as mentioned, safety for communities living near truck routes, ports, warehouses, and similar facilities. Finally, some conclusions and recommendations. Conclusions, it's clear that heavy-duty vehicles emissions pose serious health, climate, and environmental justice challenges. Electrification, stricter regulations, and logistics optimizations are solutions, and preventing pollution export ensures global equity. Finally, some recommendations. Smart driving practices. It has been shown that just by training drivers, it's possible to make driving more efficient, so more energy efficiency, and in addition, reduced emissions. Emission inspection and maintenance, which is a key element once the fleets are in circulation. Accelerated electrification and introduction of cleaner fuels, as well as the expansion of low emission zones, zero emission delivery zones in urban areas, and zero emission transport corridors, and improved urban planning as integrated strategies. And last but not least, engaging public policymakers, communities, the private sector for a joint clean freight action. Thank you so much. These are just if you want to consult our publications, you can go through this QR. Thank you.
Thank you so much, Sergio. So you have seen from the general context to the tools to how EDF is approaching this issue. Now we will be looking how UNEP is approaching this issue. And I'm sure now that the slides are yours.
Thank you. Thank you so much. Gracias. And of course, thank you very much for inviting me to this panel. My name is Soraya Esmaoun. I'm leading air quality work in UNEP. I'm also in charge of the pollution and health unit. I'm not leading the sustainable mobility unit of UNEP, but I will be presenting on behalf of my colleagues who unfortunately couldn't be here today. And I'm going maybe to bring another dimension to this discussion. So first of all, of course, we have a strong sustainable mobility program in UNEP, which has been running for more than 20 years now, which is very integrated. And I think that listening to the previous speakers, we are, of course, in the right direction, I want to believe. So we have 4 pillars in our sustainable mobility program. One is very much focusing on, of course, transitioning towards low emission transport and actually transitioning to electric mobility. We have part of our program which also focusing very much on cleaner fuels and vehicles, and I'm sure most of you are familiar with the Partnership for Clean Fuels and Vehicles, which is quite a successful partnerships. Combined, of course, with the need to support governments in vehicle emission standards. So we do a lot of work around that. We also have a project on used vehicles, and I think some of the speakers were mentioning, the need not to, of course, export or transfer the old vehicles from the north to the south. And last but not least, an active mobility program that I will be presenting today. So this active mobility program is called Share the Road, and that sounds very obvious. In other regions like Africa, we have 1 billion people who actually rely on walking and cycling for their transport, for their mode of transport. So, and yet the investments are still on roads, on roads actually. So very few cycling lanes and walking lanes for the people. So that's from this kind of contradictions that the Share the Road program was set up. The idea is to develop and adopt policies, strategies, action plans, and other measures to upscale the active mobility investment. You see some of the co-benefits on the slides. Obviously, environmental benefits, increased accessibility, particularly for the most vulnerable ones, so such as children and women in some cases, as well as road safety. And I think we also heard about this aspect of road safety through the previous speakers. In terms of the situation in the Africa continent, 35% of African countries have a policy on walking and cycling, so we can do much better. And on the right side of the slides, you see that what I was saying earlier on, or maybe not, that people are actually walking and cycling for 55 minutes a day to go from, point A to point B, or actually for all their trips during that same day. I'm just going to give a few examples of some of these non-motorized transport policies that UNEP has been supporting. So the first one is the capital of Ethiopia, the Addis Ababa non-motorized transport strategy, which aims to create a comprehensive network of high-quality walking and cycling facilities to improve air quality and public health. And this one is quite an interesting example because 100 kilometers of walkways and protected cycle tracks on the 2 sides of the streets were actually built. And it's also interesting because it's guided by the Cycle Network Plan launched in 2023 in the municipality of Addis Ababa. And we have an additional 76 kilometers of walkways, which are actually planned in the next phase. So this was done with technical support from UNEP, UN Habitat, and ITDP. Another example, no, sorry, this is not another example. We are still in Ethiopia, but this is the non-motorized transport strategy that was actually also developed and which runs from 2020 to 2029. As you can see on the slides, it has quite of ambitious targets. The actions focus on increased investment in high quality or walking and cycling facilities and measures to control private vehicles in some places such as city center and so on. The 10 years target are interesting, right? To attain WHO ambient air quality guidelines by 350 days a year. So that's very ambitious, but that's good. And greenhouse gas emissions follow the overall target sets in Ethiopia's nationally determined contribution in their NDCs. So again, when it's integrated in national plans or city plans, of course, it's a sign of, or it can be an indicator of sustainability and political willingness. This one is Rwanda. And for years, Rwanda has been really leading on green growth and on circular economy as well as on air pollution, or air quality rather, by integrating clean air into their development plan or their national development plan, sorry, at the city level, but also at the country level. And I don't know why the slides is cut. Sorry about that. But they have indeed developed a walking and cycling strategy and policy. And they have a number in Kigali. They also have a number of car-free days, which actually happen to be very successful to mobilize the policymakers, the communities, and all the other stakeholders on this. This is something that has been developed or with the support of UNEP, which is a Pan-African Action Plan for Active Mobility, with again support of other international stakeholders and actors, but really with the view of building a coalition on and an harmonized actually plan for active mobility across the continent. So this is something that is running for 10 years, I think, the Pan-African Action Plan, and has just started recently. So if in case you have questions about this, happy to of course, ask my colleagues to provide some more information about this. Then, since we are in this region, but of course, without preempting the next presentation, this is something that was done in the Americas, but I think in this region. But you can see in terms of the NDCs, the national working policies, and NDCs in the Americas. So, of course, the green and the red parts shows quite an interesting approach, especially if you look at the NDCs. For instance, the first one, you see the national policies include walking not very much in this region. So I just thought that was something that was quite interesting. You can see also at the global level that, well, actually the picture is not that good. So there is still a lot to be done. And I think I'll skip this one. And yes, actually, that was the slide I wanted not to present because we have a presentation on Bogota actually just after. But just to say that from a study done through ITDP, actually, 51% of residents live near protected bikeways, a 10% increase since 2021. And I think that, you'll agree with me, and we will see in the next presentation that Bogota is quite a good example or best practice in this field. I think I'll stop there. I put the name of my colleague who is in charge of the active mobility program in UNEP. Just maybe to say that I think that it's very important, just to conclude, that what is very important from the experience we've been having through this program is that, of course, involvement of different stakeholders is necessary. Seems obvious, but it's not, and takes a lot of time, actually. Especially considering that, as I was saying earlier on, most of the investment still goes to roads, construction of roads rather than cycling and walking lanes. Enabling environment is also extremely important. Legislative framework, which maybe, I mean, it hadn't been completely maybe mentioned before, but I think this is extremely important in terms of vehicle emission standards, but of course air pollution policies and so on. Coalitions of the willing, as well as also, of course, best practices, exchanging experience across region, but also within the same region. We saw a lot that, of course, for instance, in Africa, having this harmonized approach with vehicle emission standards, importation of used vehicles was much more successful when we had this actually sub-regional approach. So yeah, I think I'll stop there. Thank you.
Thank you, Soraya. So we are now approaching to the more local example, and we are talking now with Julian, that presenting the case of Bogota. Now we are sure.
Thank you so much. Again, I'm Julian Fernandez. I am the Deputy Secretary of Public Health of Bogota. But today I'm not going to speak on behalf of the Secretary of Health, but I'm going to speak on behalf of the whole administration, on behalf of the mayor. I'm going to speak in Spanish because I don't have too much time, and I speak obviously faster. So if you want to use the device, please do it right now if you don't speak Spanish. Okay.
This story that I'm going to tell you is a story that comes from several administrations. It is important to acknowledge that what Bogota has achieved is not the result of this administration, but it has been an effort of more than 20 years building a model of city, a coherent model of city that even has collected different perspective of the political spectrum, but that has been able to achieve some of the priorities that point towards public health. A second comment is that these efforts in Bogota have been intersectoral. We believe that intersectorality in public health is something that public health has, but I mean, I am more and more convinced that intersectorality it is most possible when the higher level. Even we can do intersectorality on public health without talking about public health. This is not the flag that unites us. The change on infrastructure in Bogota have an impact in the health, but being honest, it has not been motivated by health, but other incentives. We believe that if the health people said that public health is everything and everything is public health, I believe that is part of the reasons why the policies are condemned to be not so much relevant discourse. We have to understand that there are some flags that unite us, such as well-being. And a third important idea is how we generate the political incentives on the political spectrum that not only is understood that is led by a leftist progressive government, but the whole spectrum could take it. And we have to we need to show different sorts of arguments. Bogota has 8 million inhabitants. It's at 20 places. Locality 20, we don't see it much, but locality 20 is the biggest part of the city. It's a rural one, highly dispersed, but it's diverse. Just going across a bridge, you can change the birth expectation 3 or 5 years. You go from Pontivon to Engativá. We have done it because we have we have calculated the expectancy of life. Something that was done in Baltimore like 30 years ago. So it is possible to calculate the life expectancy even across one bridge. In Bogota, this is going to be increased with the infrastructure works. We have particular material, fixed sources as well as mobile sources, with the sum of the methodological and climate phenomenon. At the beginning of the year, we had several forest wildfires in the Amazon. With they brought the air contamination. Additionally, Bogota, if you saw Montserrat, those of you who are academicians who are here, not the tourists, but the academicians that are here, our visitors, it is in a valley between two mountains, so that increases the air contamination. Now I'm going to go a little bit faster, but in Bogota, we have a very good information. I would say that we have better information than the whole country on air contamination. We have 20 monitoring stations. We have statistical models. Bogota estimates the impact is attributable to different contaminants. And it is important to understand that there are social determinants and environmental determinants. And here we can see that, for instance, in the southwest of the city, this is a place where the overlap the environmental determinant in Bosa and Kennedy, where the poorer people live, where there is load transportation, there is informal trade, so there is social injustice, we could say. On the south, we have the land fields, the confluence between different determinants or among different social and environmental determinants make synergy on a negative place. And you require a more complex territorial approach. We're not talking only about the air conditioning, the contamination. People who live here do not have resources to use any other sort of transportation, and yet that generates a lot of difficulties. For instance, to talk about a case on the social determinants role they use on motorcycles in cities such as Bogota, and it is a phenomenon in Africa and South America, in Africa too, as an working alternative and to work and to mobilize by people with lower income has a high impact. And also, what is important here? Bogota has made an effort which is important in Latin America, that is precisely increasing the presence of air cables that I'm going to talk about, increase the high capacity corridors, and you can see it here fundamentally the building of the metro. It is kind of, it's shameful that Bogota took so long in building a metro. Underground, whether it is underground or above ground, it became a political issue. Whether I like oranges or bananas, something like that. But the best method is the one that we have, and this administration is going to deliver the first metro line. Bogota has an air plan, intersectoral plan, that includes 5 strategic axes, and I highlight each one of them. The third one, which is reduce particulate material emissions. There is another important here, the governance of the air. Who governs the air? Who should govern the air? And it is not only mobility or environmental health. Air should be governed by the civil authority. The governor of the air is the citizenry, represented by the mayor. And that is important because air is a public good by definition. So in this air plan, precisely the air plan has several intersectoral actions in terms of transportation, zero technology, mobility, active mobility, and the load transportation, or cargo transportation. So it is very complex. Well, there are no roads where heavy transportation could go through, and this is a problem that will take decades. It requires a long-term policy. Those who have worked with politicians is politicians like the things that they have the time to deliver. So we have to explain the politician that the results are not going to be seen now, but in 3-4 years, there's not going to be an impact, but it has to begin now. So when the results of infrastructure thinks the politician is going to be 80 years old, but this is something that we have, the Bogota chiefs. I have 5 minutes. 2 minutes? Okay. When I was 15 years old and I went to university, that I lived in the south of Bogota, this is the buses that we had. Those were the buses that we had then. And you would hop on at 6 in the morning because among the defect that Colombians have is that we don't like to get up early. So you would hang from the door, another behind that, and another behind that one. So today there are people who hate Transmilenio, but they forget about this. With a whole bunch of accidents today, the accidents in Transmilenio are very low, but the contamination of those vehicles who were 1970s and all the way to 1990s would work. There were buses that United States would donate sometimes, and all the risks that we had. Many times I went hanging from the door. Sometimes I didn't pay. Sometimes you didn't even pay, so you would be hanging out and then you would hop off. This is Carrera Décima, or the 10th Street. It was ugly, still is ugly, but back then it was very ugly the way that we would move. And this is today's Bogota. Even there are people who detest Transmilenio. We still are. There are many people still inside the. But the accidents have been reduced. Transmilenio has great challenges, and it is not a definite solution. But Transmilenio, which is the mass transportation, we have to think about the political incentive, and the political incentive of Transmilenio today contributes to low emissions because the public transportation in Bogota explains less than 10% of all the PM emissions and being reduced because part of this vehicle fleet is electrical, but it contributes to reduce road accidents and also transportation, and that is also social justice. Before, from Kennedy to the north of Bogota, it would take 2.5 hours that people leave from their family. Now, in the 1990s, I said now you can reach that same distance 35 minutes. Overloaded on those big, but 35 minutes. That shows challenges in terms of breathing diseases and else, but that is another topic. This has been the transition in Bogota. I will do it very quickly. There is a change in the fleet of buses with a high participation of low emissions systems, and this is a state policy, if you allowed me to say, that independently from the administration that we have, there is a gain, and it is precisely the sort of things that are achieved independently of who comes to the government. This is important. Metro, the best metro is the one that exists. There are many things in ideas that national government talks about, but this metro exists in the real world, and it's gonna allow to mobilize 18,000 passengers from the most vulnerable areas to the areas where people work. This is a above the ground metro that is going to pose some challenges, but it is expected to use renewable energy sources or low in carbon. Metro Cable. There is scientific evidence published in Medellin on how it is not only an alternative that reduces the use of motorcycle, but it reduces violence, even improves mental health. In a study that was done in how it solves impacts in health and how this generates many positive externalities. But if you convince a mayor to do it, the argument is not necessarily what I want to say, although this is an additional gain. These new projects, such as the vehicle loaders for lifts that have been increased on traditional loads, many of them free, Bogota has a place where there are bicycle lanes, and people can mobilize safely. And many workers use bicycle from the south of the city all the way to the north. Of course, somebody would say that this is unjust. What I told you was the bicycle roads that are exclusively for bicycles, that are paths, done bike lanes, but additionally, on Sundays and holidays, Bogota, more than 30,000 people go out to do the main roads, and this is a model for physical exercise. It reduces noise, improves the quality of air. This is democratic. Everybody from all social strata come. So, this is the map of the cycle lanes, bike lanes in the city. You can go anywhere in the city, basically, and the accidents are continue being important, but that is because of bicycles outside of the bike lanes and the parking area that the bicycles have. And I end with this. It is understanding that a moment in which there is a high, very strong political polarization, this sort of city requires social consensus, state policies built on what has been built already, for people to demand them. What is important is people are going to demand to continue having the bike lanes, to continue keeping for them to be safer, and this is something that I invite you to enjoy in Bogota and generates much more benefits in health than those associated to the reduction of quality of air. Thank you very much. Thank you, Julian.
A big vision from the evidence that Hanin presented to the tools that Joe presented to the approaches from EDF, the approaches from UNEP, and now the approaches in real local city. So I want to open for questions. So as I mentioned before, we want this to be a dialogue. And we have 1, 2, 3, 4, 5. Oh, fantastic. Thank you for, don't be shy. So please, if you, quick questions, yeah. And if you can identify who you want to ask the question, will be better. So we have opportunity for everyone to ask.
Okay. My name is George Thurston. I'm from the New York University School of Medicine, and I do studies of human health effects of particles for over 40 years, and I do especially source apportionment of that. And I wanted to pick up on comments that were made by Joseph and by Hanin, and that the effects of these particles are more than we think. The benefits of doing them are more, because I'm finding this, there's average particles we tend to use, PM 2.5, but in reality, these particles, as the picture Joseph showed, very good and explanatory, are really toxic and have really toxic things, and we're way underestimated. How are we going to, I asked the two of you, how are we going to incorporate that fact and realize that we are underestimating the health benefits of reducing fossil fuel in transportation and elsewhere?
Thank you, George. Hanin?
Thanks, George. I mean, I think this is, I'll give you immediate answers, but it's a really good question that probably needs a lot more thought. I think about perhaps exposure response functions that use composition of PM 2.5 and potentially starting to include some of that in the health risk or the benefit assessment. We have previously used other pollutants when we looked at the health benefits of potential transportation strategies. So NO2 just being a better marker or kind of more closely related to traffic activity. So in the past, when I've modeled health impacts of different transportation strategies, I opted for NO2 and showed PM 2.5 as kind of supplementary analysis. Not today, not specifically what I showed today. So I think that can give maybe a better idea of some of the impacts. Of course, there are other, caveats and questions we can get into in terms of causality of NO2, but I'll leave that, just give a brief answer now.
Thank you. Joe, do you want to respond? Quickly.
Thank you, George, for that very valid question that you're asking. In the Externi project series that we did back in the late 1990s and early 2000s, we treated particles from transportation as being at least 50% more toxic than particles from ordinary sources of pollution. And so we incorporated using these toxicity factors into the analysis. Also because half of the emissions that are currently emitted from the sector are from diesel, these particles are smaller, they're ultrafine particles, and they're carcinogenic by themselves. And so we use those toxicity factors to take that into account. As Anine was mentioning, we also considered using different markers like NO2 and comparing that with the PM. Also black carbon versus PM, because there are some functions for both, and seeing how the numbers would vary. So I think this is something that as the science develops, as the evidence accumulates, we can go back and do some testing and sensitivity analyses to see what different approaches tell us.
Thank you, Joe. We have another question here. We have
Hi.
a lot of questions. Thank you.
Hi, my name is Suzanne Zhou. I'm a lawyer at the McCabe Center for Law and Cancer, and I had a question for Julian about if you had any reflections on building that political demand for active transport. And I'm asking this because I'm from a city in Australia where we built lots of bike lanes, and then a lot of the drivers complained about not having parking anymore, and then now we have a bit of a backlash and some movement to getting rid of them. So.
Something that I learned during the pandemic is that sometimes scholars, we scholars, are not the best understanding how to make influence, how to influence the decision-making processes. And in order to do that, I think that the first thing is that we need to understand which are the real political incentives, and then work on these political incentives. Because I think that part of the problem is that we are like outside, and we think that the heads of the politicians are like empty, but they have a lot of things inside, of course, and most of them are very clever. So but we if we really want to understand what motivate them, we need, and that is the case of active transportation. So and truly, I think that the incentives for that are not only are not mainly in related with health, are more related with other ideas like well-being, like well-defined, like how this can be a factor to reduce social injustice. So we have to find one common narrative that not necessarily has to be the same narrative of the public health, at least the traditional public health. But I don't have too much time to go deeper in that, but just this to begin.
Thank you, Julian. And we have, another question back there.
Muy buenas tardes. Mi nombre es Jorge.
I am Jorge Luis Cuero. I am a researcher. I am a scientist. I would like to participate with 2 or 3 scientific theses to contribute to improve the quality of life of this forum. The first one, about 40, 50 years ago, a scientist discovered this H2O engine, and today we have the oceans with all the periodical table or the elements that we could build all sorts of engines run with in an alkaline way for life. The second thesis, air contamination, the high contamination of the environment does not get ill, does not get the human being ill. It is the human being who is proliferating or disseminating diseases that promote disease as self-depredation. And the third thesis is, if I am alkaline and what I have to do is I have to transform through a culture, a scientific culture, pedagogical culture, the acid intelligence, which is the ambitious one, aggressive one, and violent one that does not improve and does not want improve quality of life. Thank you very much. Thank you. I don't know if you have something. Thank you for contributing with your thesis. No, we have very short time and we have many questions. So, bueno,
quick question. Many thanks to you all. Very important. I'm here to say that the susceptibility of the individuals has to be taken into account, of patients, etc. Because what I see are assessment of measurement that are good in general, but when I see Addis Abeba and the cycling pattern, I can imagine about a patient there under the sun. So we need to take into account that there is that's what I do work on, a sort of exposome with the interaction among the factors that has to be taken into account. Thank you.
Anyone want to contribute? Yep. Good. We have one other question.
Okay, thanks. My name is Daniel. Les voy a hacer una invitación.
I'm going to make an invitation in Spanish. The infrastructure to promote sustainable mobility, the active mobility is necessary, but we have to change the perspective of a special distribution or spatial related to space, where everything is measured by air, to perspective of ecological corridors. The city is part of some ecosystemic components. When we plant trees around the bike lanes, around the public space, we are going to improve not only the behavior of people who use or move this way, but also we are going to absorb particles, we are going to generate oxygen, etc. So it is changing an invitation to change the perspective, not only a distribution of square meters for the bike or to walk, but to understand all the ecosystemic component that is part of.
To contribute for those that speak Spanish.
Bueno, vas a responderte. Yo creo que es.
You're right. Bogota, for instance, has many rural zones, and it is not only Suma Paz, but we are next to the eastern mountains, and the transition between ecosystem and the urban area is almost imperceptible in some blocks. And precisely, not to go into detail, because I know that time is of the essence, what is happening right now in Bogota in particular, with an increase on the presence of rodents that are associated, it should call our attention on how the cities really get organized, not only to generate better health for people, which is the traditional focus, but also how this generates better health for the ecosystems, if I'm allowed, and for the different ways of life. To think that the city not only is the habitat of people, but the habitat of the of wild fauna and other life beings, that implies a change. One Health not even has an answer to that, because although One Health says no, finally continues being that'll be difficult to make politically, because animals do not vote.
To underscore the importance of the integrated planning and approaches, and green infrastructure is one of them, but also the important to consider the different uses of urban spaces. If we just focus on cycling and we don't look at the competition with other activities such as freight, which is also very important and increasing, So we might be just designating and designing cycleways without considering this competition and eventually the conflicts between the separation of lanes and the usage of the other uses. And in addition, I would like to also highlight the importance of bringing together the different stakeholders from the very beginning, including the business sector. That can be a major ally in once considering the great success of pedestrian areas and cycleways in different places.
We have one last question, and before I pass the microphone to Joe, I want to invite you to stay here. There's another session now in lunch, and the lunch is there, so you stay here if you want to take lunch. Take lunch here. Joe?
Yeah, I'll try to make it very simple. Very good point. I appreciate what you're saying. I will respond in English because no tengo vocabulario en español. One other thing that I wanted to add was the issue about urban planning and designing of the city. The city is an extension of the ecosystem of nature, basically, rather than the other way around, that nature has to adjust for ourselves, the fact that we're there. So that blending adds harmony to the design. But another key actor, stakeholder that should be around the table is not only the planners, not only the engineers that have to do this, measure the need for how many cycleways you want to have, etc., but it's public support. If the public does not support something, it's not going to happen because there won't be a pressure on the establishment to provide certain services. So in a sustainable urban mobility envision, there's the issue about equity, there's the issue about accessibility, there's the issue about integration, distributional effects. So all these things have to be taken into consideration. And in a sustainable approach, you have the economics, you have the environment, which we've been talking, but then there's us, the people who actually use these services. So thank you for your question.
Thank you.
Maybe one thing that I would like to add, also in the case, and I agree with, of course, what has been said by my fellow panelists, one of the things that we've also noticed, particularly in low and middle income countries, even when there is political will and laws and regulation and standards in place, they are not always fully implemented. There is a big gap in terms of compliance and enforcement, particularly in low and middle income countries. So I think that even if there is political will and the system is in place, we also need capacity building, and we need to actually train and support countries and these different stakeholders that we've been talking about to be able to fully implement these policies. I think that was an important element just to add. Thank you.
Thank you, Soraya. And that is an important reality that we need to take into account. The last question. Sorry. Yeah. Oriol.
Thank you very much. I'm Oriol Teixido, Middle East Associate Director for Ricardo. And I agree also with George that we are underestimating transport emissions. And I think also one is for the toxicity, but the other one also, I think the elephant in the room is the real world emissions of the vehicles. We all know about the Dieselgate that happened many years ago. It's still happening. But also there is all the tampering on the vehicles. We see all the black smoke on the vehicles. This is one. The other one, I wanted to bring the attention also, electric vehicles also have emissions. It's something, they are better, they don't emit NOx, they don't emit gases, but there are also PM emissions into that. So I wanted to ask maybe to Hanin, is that already accounted in the estimations that we do? And maybe to Sergio, how are we tackling that issue?
Yeah, thank you. Thank you for that question. In the study I showed today, it's not accounted for. We're just using PM 2.5 mass as an indication and doing a source apportionment from transport. But there are models and projects that we've completed where we account for the real world driving emissions using kind of different emission models than the regulatory ones, because the regulatory ones are based on lab cycles and lab measurements that are not representative of real world conditions. So sometimes we might incorporate things like remote sensing from on the roads, or we can follow our vehicles and measure, or not measure, but track their driving cycle, and then put that into an instantaneous emission model and have more realistic and variable really estimates. So we do try to account for that to the extent possible. And I agree with you, it's a big problem. It's a really big problem. What was the other part of that question? Oh, electrification. Yeah, I think I'm no expert in toxicity of PM 2.5, but my understanding is that the fossil fuel based PM 2.5 is perhaps more toxic. But I think we don't know. There are probably some really open questions with the PM 2.5 from non-exhaust particles. And as far as I know, in the health risk assessment of transportation strategies that we've done, and some colleagues, this is not accounted for just yet, and it's definitely an upcoming issue that we need to pay a lot of attention for.
About the existing emissions, there are a number of things to be said, starting with the bad driving behaviors. The age of the fleets tend to be very old and poorly maintained. Inspection and maintenance is basically inexistent in many places, meaning that these emissions can go higher and higher as the time passes without maintenance. In addition to the traffic conditions and tires. Part of what you are mentioning is not just the tailpipe emissions, but also the resuspended and the particles that are emitted due to the circulation of trucks and other vehicles. But in addition to that, even the best electric vehicle, just stuck in traffic, is not really behaving in the way it should be. So the land use planning, including but not limited to zero emission delivery zones, is essential in order to really increase the efficiency of the use of these electric vehicles, and also reducing emissions from other vehicles by not allowing them to enter into these zero emission delivery zones. So that's a way in which it can be included, but obviously the tire factories is also another major one. Thank you.
Joe, yeah. So I think we are now running late. So I want to thank you first, the panelists, and please help me to make an applause to the panelists for fantastic job answering these questions. I know there's a lot of questions there, so but the panels will be around the conference, so don't be shy and stop there and talk with them. Thank you again for stopping by in this session. Transportation is more to come and more to learn. Thank you so much and enjoy the conference.